Stem. All right, so if you've read and understood, considering it's surgical anatomy station, please tell me what are you looking at? Identify the structures. Labeled,
Okay.
please.
A is long head of biceps
Which one?
brachii.
A?
A.
Okay. All right. What exactly are you looking at? These marked structures represent what?
All of these this is the brachial plexus.
Very good. These are the brachial plexus.
Okay.
Please identify the structures. A is biceps.
Long
Brachialis.
head of biceps.
Okay. B, please.
B, this is median nerve,
C, please.
ulnar nerve.
D and E and F. Quickly, please tell me.
This is axillary and musculoskeletal.
Axillary nerve, say, are you saying it? D. What is E and what is F?
F is radial nerve.
Okay, if you're not sure, then we can come back to this one later. Please tell me
Okay.
what are the parts of brachial plexus that you can see right now?
Parts.
Parts of the brachial plexus, yes.
Okay. Here I can see divisions of brachial plexus and branches of brachial plexus.
Okay. What about the cords?
And
So if you're looking at the divisions, then you're looking at the cords
the
and
course.
then
Okay.
branches as well. Okay.
Yes.
The
Yes.
little bit branches. So these three. Please tell me what are the branches of the brachial plexus?
Brachial plexus, musculoskeletal, axillary, radial nerve, median nerve, and ulnar nerve.
These are the branches you're telling me from the three cords. Okay. But the question was, what are the branches of the brachial plexus? So then you can tell all the branches. So one has to
All.
pay attention to the question, right? Tell
Okay.
me, right, you have already told me what are the injuries that are possible on the brachial plexus?
Injuries.
Yes, please.
We have injuries to the two roots of brachial plexus, to trunks, upper and lower trunk. We
Yes,
have injuries to branches, radial, median, ulnar.
yes. Can you tell me what is the injury called which affects or damages the upper nerve roots?
It's called Erb's palsy or
Yes.
Whittle-Tib
Yes, how does the patient present motor and sensory loss? Please explain.
motor patient presented with arm abducted and medial rotated,
Yes,
uh, forearm extended and wrist flexed.
yes,
Uh, and he has sensory loss of lateral side of the arm and forearm and thumb.
okay, good. Please tell me what are you looking at here in picture C?
See, I'm looking the bones and what you are talking about is the shoulder joint.
All right, good, shoulder joint. Please
Okay.
tell me how the shoulder joint is formed.
Joint is formed from head of humerus and the glenoid tubercle of the scapula
Okay,
and superiorly
okay,
spine and acromion process of the scapula.
okay. Please tell me what are the structures which strengthen the shoulder joint?
Uh, Rotator cuff muscles,
And
ligaments,
ligaments. Which ligaments, please?
um,
Coracoclavicular,
clavicular,
crocodilular,
coraco,
acromion,
humeral, and
crocoacromial.
acromion.
Okay.
Yes.
Please, what are the muscles which strengthen the shoulder joint?
Rotator cuff muscles, which are supraspinatus, infraspinatus, teres minor, and
Yes.
subscapularis.
Okay. What are the muscles which are inserted in a bicipital groove? Where exactly is bicipital groove located? Can you tell me?
It's a number one.
Yes. Okay.
Yes. Okay.
In picture.
Superior to it is the short hood of it's the medial head of triceps and inferior to it the lateral head of the triceps.
Please tell me tendon of the, okay. Please tell me the quadrangular space, the boundaries, and what passes through it.
Quadrangular space formed by humerus laterally, superiorly teres minor, inferior teres major, and medially the long head of triceps. Structures passing through it. Uh, they are
Axillary nerve and which vessel?
axillary circumflex humeral.
Posterior circumflex humeral
Circumflex
vessels.
humeral artery.
Okay, please tell me origin and insertion of pectoralis major muscle.
Pectoralis major muscle origin has two heads, clavicular head from the anterior border of medial third of the clavicle, and cost sternocostal head from the anterior of the sternum and upper six ribs.
Okay, what is the nerve supply of pectoralis major muscle?
Medial and lateral pectoral nerves.
What are you looking at? What kind of imaging is this?
This is CT for shoulder joint.
Is it CT?
CT as
Is it
both.
CT?
Yes. This CT or not CT?
No, it's not CT. Okay, what is
MRI.
one? One,
Okay. One is the acromion process.
four, please.
Four, it is the lateral end of the clavicle.
Right. Six, pointing at
Supraspine. Six is the glenoid
cavity.
cavity.
Five,
Deltoid muscle.
please tell me what are the indications to ask for this kind of imaging?
Um,
When would you ask for this kind of imaging?
rotator.
This is MR arthrogram, not
Yes.
CT.
Okay. I'm sorry.
Yes. So when would you ask for this kind of imaging?
Uh, any ligamentous or muscular injury or in
Hmm?
the rotator cuff muscles or shoulder joint instability.
Yes. All right. Please tell me what are the factors that decreases the stability of the shoulder joint?
Shallow glenoid
Very good. And
lax ligaments
the legs capsule with ligaments. And
or ligaments and anatomically a lower quadrangular space in the inferior border.
yes, uh, inferiorly presence of quadrangular space. Okay,
Yeah.
very good. Now, Okay, next part. Please tell me the boundaries of cubital fossa.
Cubital fossa boundaries laterally pronator teres, medially uh,
Here exactly it's located.
yes.
So
Uh,
boundaries are spirolateral, brachioradialis
laterally
muscle,
brachioradialis and medially the
pronator teres,
pronator teres, and superiorly the imaginary line passing from both epicondyles.
hmm, and the floor is bibrachialis. And what are the
Brachialis.
contents of cubital fossa from medial to lateral, please? From
Uh,
medial to lateral.
median nerve,
Yes,
brachial artery,
yes, and
um,
biceps tendon.
tendon biceps, and laterally the radial nerve.
All right, okay. How the elbow joint is articulated or formed?
For the articulation of head of humerus articulated with the capitulum from the
Head of the humerus?
uh, head of humerus, head of radius,
Radius, yes.
head of radius
And
articulated capitulum, and olecranon process of olecranon fossa of the ulna articulated with the trochlea of the humerus.
okay. If you are
Uh,
asked to draw brachial plexus on a living person, how would you do it?
brachial plexus.
Brachial plexus.
Again, question again, please.
If you are asked to do the surface anatomy of the brachial plexus on a living human being, how would you do it?
Brachial plexus roots lies posterior to the scalene muscle. Then trunks passing behind the lateral border of the clavicle. Then divisions uh, around then cords around the axillary subclavian artery, and divisions around the axillary artery in the axilla.
Yes, but you would have to draw it on a human being, right? And you would have to tell how is it formed. Right. I had to ask you one more. Uh, where exactly would you find medial cubital vein and cephalic vein?
Uh, ceph cephalic vein. Medial cubital vein is superficial in the superficial to the cubital fossa.
Superficial. Okay. Which side? You didn't tell me. Medial side or the lateral side?
Uh, Cephalic in the lies in the lateral side, and median cubital vein is connecting basilic and cephalic in the
Very
um,
good. Yes, now you're telling me. You know it, so you have to close your eyes and explain so that I understand as well. Good.
okay.
Please tell me what are the movements which are possible at the elbow joint?
Uh, Flexion, extension, and
Yes, spinal
upper
cord.
radioulnar joint, pronation and supination.
If a patient comes to you and you
Okay.
suspect that patient has a supracondylar fracture,
Okay.
right? What would you be worried about and how
I
would you
will.
assess that?
Okay, I will be worried about arterial injury. So could be lost pulsation, distal pulsation. I will
Yes,
assess for distal pulsation. There could be injury to an anterior interosseous nerve, a loss of OK sign, radial nerve injury, and will lead to wrist and finger drop.
yes,
Also, we will be worried about uh, ulnar nerve injury and
Mm,
uh,
no.
partial clue hand.
All right. So you've decided to do an imaging and X-ray. How would you
X-ray.
determine on X-ray that patient has supracondylar fracture? What would you see?
I will see uh,
Joint effusion, there'll be sail sign
okay.
in hand. Yes. Okay, good. Now we have covered both hands.